Yeah, my pleasure. My pleasure, Shaun. Nice to meet
Yep.
you.
Yeah, you too. Now, we had a little chat via email the other day about some of the adaptations you've had to make to your clinic, the way that you've adapted to the current COVID-19 situation, and how through those changes that you've had to make, you've actually seen some new opportunities and some things that have come out of that. Is that right?
Yeah, no, absolutely. Like, it's definitely been a time of change, and one thing that has impressed me already we're only literally we're in week 3 of the tighter restrictions, but it's amazed me how adaptable our staff has been and how resilient, and how adaptable and resilient our patients have been so far as well. So yeah, I think everyone's doing actually really well, considering we're only week 3 into these tighter restrictions.
Absolutely. So for anyone who's watching this, could you give us a little bit of a rundown on yourself and your business, just so we can get some context?
Yeah, absolutely. So, yeah, we're a naturopathic. I'm a naturopath. I graduated in 1987. So I've been in practice this year for 31 years. So I've been around the block a time or two. And yeah, health's changed a lot over that time. And, obviously now we're being forced to look at how we do business a lot more closely as well, with the things changing as they have. But as one of my really good patients said, we were talking about the fact that you and I can talk like this, we can talk with patients like this. They said, with technology, this is really the virus that we've all been preparing for, that we can, so, that maybe there's some sense in that, I don't know.
Absolutely.
But yes, so we're a naturopathic practice. I have myself and five other naturopaths, and we have a staff of about 8 or 9 girls that do what we call, some of them work as what we call CAs, or care assistants, serving the clients, making appointments, or patients rather. And then we have, my wife sort of runs a bit of a marketing department as well. We have a couple of girls there that do all of our marketing stuff. And then my daughter Gabrielle does all our social media and Facebook stuff. So for us, it's very much been a family business, for the whole 30 years as well, and wouldn't be where it is if I didn't have my wife, keeping me in check and running the whole show. So I get to do what I love to do, which is seeing patients. And I do a lot of the training and education with the other practitioners as well. So that's my role. But first and foremost, it's my patients, and talking with my patients is what I really love to do the most.
Fantastic. It's great to hear from a practitioner who's been in the industry for as long as you have, and is still enjoying it, still getting a lot out of it. Times like this, when restrictions are put upon us and we're having to adapt and change, being able to do that obviously is very, very important, and you've clearly done that well. So maybe, first of all, whereabouts is your clinic based? Which state, which city?
We're in Hamilton, which is a suburb of Newcastle in New South Wales. So we're about 2 hours north of Sydney.
Okay, sure. And so as a result of the current restrictions that we're all dealing with at the moment, how has your business pivoted, changed direction? What have you done specifically to adapt to it?
Well, probably just as you were saying that before, we definitely haven't got everything all worked out, 100%. As I said, we're week 3 and we're still day to day there's changes, and day to day there's areas we still need to improve upon. But so of the first thing, 4 of our naturopaths are now working from home. So we started off doing Skype for patients that were up to that, or Zoom, or phone consultations. Mm-hmm. And some patients like to do the FaceTime on the phone, which is great, because if you can see a person, it definitely helps with that connection. And we've changed some of that now. So the pracs are working from home, and then our CAs, the pracs notify our care assistants once they've dealt with the patient, and then the CAs will then ring the patient and follow up with payment. And then we either mail stuff out, or we do, we have a pickup station in the front counter. So from as soon as this all happened, we closed the office to patients, looking at, like, because obviously the goal was to look after the health of our patients, but also our staff health, and also our health as well. So we closed the office. We stopped doing face-to-face consults straight away. We set up a pickup station where we put a long table actually in our front doorway. So if someone does want to call past and pick stuff up, once they've already paid by phone, the CAs will just put their package on the table. The person just parks out the front, comes in, grabs their package and sort of goes. So that's been working well, or we're posting stuff out. We have so as I said, we're doing online or phone consults. We're trialing a new video platform called DoxyMe. And I'm not endorsing it in any way, but they've got a free trial that you can do, or that's ongoing. Yep. And we're going to try that next week as well, because it's and I'll talk a bit more about that a bit later on. We also have late last year we started up a new part to our practice called the Herb Bar, and we've set that up as an acute consultation situation. So even if someone's not a patient or hasn't been in, through our normal consultation process with one of our pracs or myself, they can actually ring up, speak to a practitioner, do a mini consult over the phone, and then they can be recommended supplements or help at this time as well. So that's worked well for us, just to be available to everybody, particularly at this time, like no matter what their experience is in natural therapies.
Yep.
One of the big changes, so obviously, again, in this period of time, we've had to change our outgoing texts and confirmation texts. We've had to change all our emails. So, just to let people know, as we've had to change that, what the new changes have going to be. And probably one of the big things that has probably this whole situation has confirmed even more for us as naturopaths and business owners is we need to keep in touch with our patients. So all of my pracs have actually phoned all of their current patients, for starters, personally, to touch base with them, see how they're traveling, see if they need any extra support, but more around touching base. And we'll do this again and again as we go. We really need to keep in touch and look after our communities that we've built and nourished and nurtured over these years, so that they know that we're there for them. So probably that's a really, really big thing. We're doing more posts on social media. We're doing Facebook Live interviews, and really trying to keep sending that message out of staying positive, what you can be doing, how to survive at home. I've done some really nice interviews with people that have been a lot of fun as well. So, as naturopaths, that whole consultation process is about rapport, and we need to be a bit entertaining as well. So, I've actually kind of enjoyed that myself. And we've also, with our staff, we've registered as a business with the JobKeeper program that the government's just endorsed or put through Parliament today. So that's been great for us, because I'm on holidays this week. I've no patients booked in. We've sent our confirmation text for patients for the first 2 days, Tuesday, Wednesday next week. And so far those days look like they're going to hold okay. We've been able to convert those patients over to either this new platform or a phone consult. Yep. So we kind of know how those 2 days are looking. We've got months of this ahead of us. But the JobKeeper award's been fantastic, because we can keep pretty much most of our admin staff, and we're going to focus on this time of doing a lot of jobs that we've just not had time to do before. We're going to revamp all our like one of our care assistants is also a nutritionist, so we're going to get her to redo a lot of our recipes and do blogs. So we're going to try and really use this time to give our whole business, all our handouts, all our resources a real revamp and overview, so that when we are ready to start back in full swing, and hopefully we'll keep, going some sense of being busy over this time, but we're going to use this time, because we can pay our staff, or the government can provide that money, to really do a lot of extra things, as I said, that we normally haven't gotten around to. So that's for us has been a real positive.
Yeah. Look, that's an interesting point. I'm hearing this a lot from people at the moment, that this is an opportunity time for us. It's an opportunity for us to do the things that we didn't have time to do before, to reinvent things a little bit, to make improvements that we couldn't do before because we're just snowed under with all the other work that normally happens. And so this is a very unique situation, one that may never happen again, where we're able to just literally pause for a period of time, to a degree,
Well,
and get some things done.
yeah, absolutely. And I think that's in our personal lives as well as in our professional lives as well. So,
Yeah, with
yeah,
no fear of kind of getting left behind. With the industry moving on without us, everyone's in the same boat. So it is an opportunity to take a breath. And you mentioned before that this is a really good time to reach out to your clients and let them know that you're here.
yeah,
I think that's a really important point, just from a personal point of view as well. That it'd be very easy for our patients, our clients, and just friends and family to feel very isolated, because we are isolated.
yes,
And for those who are usually, or you're used to seeking care from someone like yourself on a regular basis, and the feeling or the thought that might stop can be quite an intimidating or fear-inducing thing for some people when they rely on a health practitioner. So
yeah,
just a simple phone call or an email or a message or something can mean a lot to just let people know that you're still there.
yeah, absolutely. And my concept around patients have always been that once you've been a patient of mine or the practice, that we're your practice for life, and they're our patients for life. So, from my point of view, that's what community is all about. That if someone's taken the time and the effort and spent the money to come and see you, then they've put their faith in you, then we need to be there for them. So, yeah, so that's a really good opportunity to be looking after all of our patients currently and all the patients that have been in to see us. So again, as time maybe frees up a little bit, as we've got staff here looking for extra things to do, we can do a lot of that. So yeah. But yeah, no, really, yeah.
You mentioned before.
Really
you mentioned before some of the technologies and things that you're using, Skype and FaceTime and so on. Is there one in particular that you feel has been the most effective, or that you've used most regularly?
Well, probably it's amazing how easy it is just to use a telephone. If you don't have any other resources, if you don't have any other contact, you can, if you can use a phone, if you can listen to what your patient's talking about, if you can meet them where they're at, just that is a great start. Someone mentioned the name of a new platform that we're looking at called DoxyMe, and it's just a video platform, very secure. And what happens with that, and again, I'm not endorsing it, we're only just literally trialing it this week, but their security seems really up to speed. So I register as a practitioner and I send the link to the patient, and the patient doesn't have to enter any personal details whatsoever. So no patient details are kept on the platform. And they click on the link, they put their name in, and then they'll appear in a virtual waiting room. So if I'm on the phone if I'm on the video having a call with someone, then I'll see the next person's waiting in the queue, so to speak, and I can send them a little message. I mean, I'm sure there's lots of platforms out there like this, but this one's looking quite good. At the moment, we're using the free trial, so the pitch is SD, not HD, so the quality is not incredible. It's not probably as good as what we're seeing here, but it's definitely a starting point for us, and it's easy for the patients, and it seems to be very, very safe with personal information. So that's probably the main thing. And just Gabrielle's getting really awesome at all her Instagram and Facebook lives and stuff like that. So yeah, trying to just make the most of the technology.
Yeah, that's right. It's there for us to use. So it's an opportunity for us to make the most of it.
Yeah.
Have you noticed any limitations in the way that you would interact with your clients? Obviously, you're not sitting in the room with them. You don't have that physical kind of rapport. Yeah. But through the use of videos and audio and phone calls and things like that, apart from those things, are there any limitations that you're noticing, things that might limit the effectiveness of a treatment or something like that?
Well, I think the big thing, obviously, is not having a person sitting in here with you. But one of the great skills that we have as practitioners is to be really engaged and present when we're talking with someone. So that can still happen, via video calls like this. For a lot of my patients I've been seeing a long time, missing out on having that hug every time they come in. That's what I'm probably missing at the moment, and maybe they are a bit too. No physical exam, that makes things a bit more challenging, if someone's got gut health, even things like nails and tongue. But you can still do nails and tongue, like this. I won't stick my tongue out to show you what that looks like. There's a friend of ours, Katie Barron, she's doing a course on how to do physical exams online as well. So there's so many resources popping up at the moment about how to do online consultations. So there's some really great resources all around. Like everyone seems to be doing something around how to do a better online consult. So I'm sure there'll be some great tips there as well.
Yeah.
And the other thing that I always do with my patients is iridology. So I'm missing that. I'm not quite sure how to go about getting a good enough image of someone's eye to actually, give them some descriptions from that. But yeah, they're probably the things we're missing out on. The hugs for me, and the iridology and the physical exam for sure.
Yeah, for sure. And so I guess there's some limitations going through those. What about advantages of this current situation? Is there anything from a clinician point of view or business point of view that standing out as positives or advantages in this current?
Yeah, look, definitely. One of the interesting things that have come out of it with Prax working from home, myself at the moment, I'm coming into the office and I will be doing all my consults from here because it's just easy. I like the format. We've got the office. We're all working in separate rooms. It's a very safe environment. So I'll be coming to work. The other Prax will all be working from home. But we can from a business point of view, we condense our business hours. Like we work generally later on a Wednesday night, later on a Thursday night. So we'll now be able to have the office hours close at maybe more respectable times. We might even start a little bit later because we're finding that if the Prax are doing their consults, they can be patients can be cared for the next day. So if one of my Prax is seeing patients tonight online at 7 o'clock, the office doesn't need to be open for the Prax to actually service that patient. And then the CAs can contact the person the next day and then deal with, supplements or natural medicines, and then also importantly making that next appointment as well. So yeah, condensing business hours. It does seem to be, from some of the stories I've heard, saving our patients a lot of transit time as well. So, rather than half-hour trip in, half-hour appointment, half-hour trip home, hopefully that's going to be an advantage. Now, unfortunately, my wife's here to hear this, but I'll say it anyway. So far, I'm finding that my online consultations, I'm actually running to time a bit more effectively.
Right.
So that's interesting, she said. Like a lot of other Prax, that is a bit of a bugbear of ours, is that we don't always stick to our time. So, but I'm finding that people seem to be a little bit more happy to get on, talk about what we need to talk about, and then to get off knowing that it's a set period of time. So, so far so good. And yeah, so that's some of the changes, or some of the, I guess, the benefits that we've seen.
And do you think that after this period of time is finished and restrictions are lifted, you'll continue using this format in some way, some capacity?
Look, it would be really interesting to see, Shaun. I think some things will continue the same. I think some people might actually enjoy this format of having consults like this. But I think a certain, or a pretty large percentage, I think, will return back to the old model. It's all a bit unknown, isn't it? Like how things are going to be different. I think we'll be doing a lot more online stuff. We already do a lot of Facebook and Instagram and community building like that. But I think what's going to come out of this even more, if we want to future-proof our businesses for the next time something like this happens, as opposed to, hoping that it never happens again in our lifetime. But I think one of the best things we can do moving forward is to really try and nurture and build our community bases. So I think every practice needs to be thinking of that, and what they can do to build that base of people, or base of loyal patients, that if something like this happens again, we've got a bigger base to work with to keep our businesses going and keep looking after people as well. So we already do some online programs, and I think we'll probably look into doing more stuff online. And as I said, the goal being to nurture and grow our base community. Yeah.
And so would you say by and large the patient responses so far have been positive, this new model?
Look, I've been amazed, and I know I said this a bit earlier on, but I've been really amazed at the adaptability and the resilience of both ourselves, actually, as well, but also our staff have been phenomenal, coming up with great ideas and suggestions. But also a lot of my patients as well. Like, it's kind of interesting. A lot of my older patients that I thought would be more rattled by what's going on and more stressed have actually been very commonsensical. You know, a couple of them said, look, we grew up just after World War II, or, you know, we've been through tougher times than this. At least now you can still go to the groceries and get all the food, really.
Yeah.
You know, except if you're after toilet paper or flour or rice. But a couple of them said even the toilet paper, you know, cut up the newspaper and stick it on a nail in the shed like they used to do anyway. But yeah, I've been amazed at how resilient people have been. And some of my funny thing with FaceTime and even like with video conferencing or video calls is some of my patients haven't been keen to do that. And it took me a little while to work out, but one of them said, look, I've just got out of the shower and I don't have any makeup on and I'm still in my, you know, tracksuit. So, you know, the ones that maybe haven't wanted to, you know, have this video connection, it's because they're, you know, taking life even more at the, in a more relaxed state maybe than they normally would.
I wonder if we'll all relax even further as time goes by. If this gets stretched out, and you'll start to see more of those people with the hair messed up and no makeup on getting on video.
Possibly.
But
yeah, maybe a nice shirt on up top, but maybe shorts and thongs.
Exactly,
on.
yeah. Like you and I are doing right now, right?
Yeah, exactly. I was going to ask you what you're wearing.
No, that's great. Look, Peter, this has been great. It's really good to talk to someone who's managed to find a way to adapt and innovate. And really it's a period of forced innovation for all of us. We have to innovate, we have to adapt, or we can't get left behind. There's no other choice. So it's great to see that you've been able to find a way to do that, and your entire business is working in unison on that. And that's a great story. So thanks for sharing it.
No, my pleasure. My pleasure. The biggest probably challenge for us is not ending up on a negative note is, but we all need to have businesses to come out of this with as well. And probably the biggest challenge that I see, and I don't know how this is going to go, like I've got, I think, 4 or 5 new patients booked in next week. We need our new patients. You know, as practitioners, there's always natural attrition of people that have either gotten better, moved away, decided it's not for them or where they want to spend their time and effort at the moment. So we need our new patients coming in to keep the business topped up, but also for our practitioners to be able to grow their base as well. So that's probably the biggest challenge, is how we can sort of let people know that we're still open, we're still dealing with gut issues, autoimmune, thyroid, like all of those reasons why someone would come and see us initially haven't magically disappeared because we're all distracted with the coronavirus. So we need to somehow get that message out that we're here, we're open for business. Things might look a bit different, but we need those new patients coming in. We need patients to be referring so that we can keep, you know, steady through these times as well. But yeah, as I said, like so far, you know, I do have a few booked in next week, and I know some of the other pracs do as well. So I'm hoping things sort of settle down a little bit and we can keep pushing that message out there that we're here for you. We're here to see new patients as well as care for our existing patients as well. And I must say one more thing before finishing is that my wife is the one that is so totally responsible for all of these ideas and suggestions. As I said, I'm great with the patients. She's definitely the ideas person behind all this change, but it's definitely been a family effort and a team effort to, you know, be doing as well as what I think we are so far.
And that's good. I'm sure she's sitting off to the side now, smiling and making sure that she's acknowledged that recognition. So that's good.
Yeah, absolutely.
Now that's a really good point that you touch on there. Just as we wrap up, that there is a lack of confidence in the general public at the moment, just with regard to everything we're dealing with. And so, as a community of health practitioners, it is important that we do our best to provide the community with confidence that life goes on, we're adapting, that we're still here to service and assist you in however we can, and that, you know, continuing to put that message out from our perspective, from the community of health practitioners, I think is going to be really important as we go forward and as things start to get potentially a little tougher for people. Let them know that we're still here to help them.
Yeah, absolutely.
Yeah. All right. Thank you, Peter. Thanks for your time today. That's been great.
Thank you so much. And yeah, I've enjoyed having a chat with you, Shaun.
Great. You have a good day. Thanks a lot.
You too.